Major perioperative adverse events of peroral endoscopic myotomy, a systematic 5-year analysis. Introduction. Peroral endoscopic myotomy, POEM, has become an attractive alternative to Heller myotomy for treating esophageal achalasia and some other esophageal motility disorders. POEM was first described by Inoue et al. In 2010 and soon attracted worldwide interest by its embodiment of natural orifice transluminal endoscopic surgery. Over 3,000 POEM procedures had been performed by 2015, with no reported mortality or need for conversion to open surgery. In 2012, the International Peroral Endoscopic Myotomy Survey, IPOEMS, determined a 3.2% incidence of severe related adverse events. In a 500-patient analysis by Showa University Northern Yokohama Hospital, where the procedure was first reported, an all-inclusive adverse event rate of 3.2% was similarly ascertained. Until now, major perioperative adverse events, MAE, of POEM have never been fully addressed in terms of incidence, risks, prevention, and management. The aim of the current study was to investigate these issues through analysis of a large patient cohort, N equal 1,680. Background and study aims. Peroral endoscopic myotomy, POEM, is now a widely used treatment for esophageal achalasia, supported by several large cohort studies. Although major perioperative adverse events, MAE, are rare, in-depth investigations of related risks and preventive measures are lacking. The aim of this study was to systematically assess MAEs during POEM by analyzing their incidence, risks, prevention, and management. Patients and methods. This retrospective single-center analysis included all patients undergoing POEM between August 2010 and July 2015 at Xiao-Cen Hospital. Major adverse events were defined as vital sign instability, intensive care unit, ICU, stay, hospital readmission, conversion to open surgery, invasive postoperative procedure, blood transfusion, or prolonged, greater than 5 days, hospitalization for functional impairment. Results. A total of 55 patients, 3.3%, experienced MAEs. Delayed mucosal barrier failure, delayed bleeding, hydrothorax, pneumothorax, and miscellaneous. 4 patients, 0.2%, required ICU admission. No surgical conversion occurred, and 30-day mortality was 0. In stepwise multivariate regression, institution experience of less than 1 year, odds ratio, OR, 3.85, air insufflation, OR 3.41, and mucosal edema, OR 2.01, were identified as related risk factors. After introducing CO2 insufflation, the MAE rate declined to 1.9% and seemed to plateau after 3.5 years at approximately 1%. Conclusion. In general, POEM appears to be a safe procedure. Major adverse events were rare and could usually be prevented or anticipated, and were all managed effectively.